What is Medicare? Who can get Medicare? What does Medicare cover? How much does Medicare cost? Where can I get more coverage? How do I choose? When can I enroll? When can I change my coverage? How can I save money? And where can I go for help? The first question is, what is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It is funded in part by taxes you pay while working, and it is individual health insurance. Medicare is not a family health plan. It is not Social Security. It is not Medicaid, and it is not free. Who can get Medicare? U.S. citizens and legal residents. Legal residents must live in the U.S. for at least 5 years in a row, including 5 years just before applying for Medicare. You must also meet one of the following requirements. You must be age 65 or older. You can be younger than 65 with qualifying disability, and you can be any age with a diagnosis of end-stage renal disease or ALS. What does Medicare cover? Original Medicare has two parts. Part A is hospital insurance, and Part B is medical insurance. Medicare Part A covers hospital stays and inpatient care, including your hospital room and meals, care in special units such as intensive care, drugs and medical supplies used during an inpatient stay, lab tests, x-rays, and medical equipment as an inpatient, operating room and recovery room services, skilled nursing services, some blood transfusions, hospice care including medications to manage symptoms and pain, part-time skilled care for the homebound after a qualified inpatient stay, and rehabilitation services after a qualified inpatient stay. Medicare Part A is hospital insurance. It is premium free if you or your spouse worked and paid taxes for 10 years or longer, cannot be denied coverage. Coverage is nationwide, including any qualified hospital in the U.S. Coverage and costs are per benefit period. Must be admitted as an inpatient, not on observation status. And it provides additional 60 lifetime reserve days. Part B covers doctor visits and outpatient care, including doctor visits when you are in the hospital, an annual wellness visit and preventative services like flu shots, clinical laboratory services like blood and urine tests, x-rays, MRIs, CT scans, EKGs, and some other diagnostic tests, some health programs like smoking cessation and obesity counseling, physical therapy, occupational therapy, and speech-language pathology services, diabetes screening, education and certain supplies, mental health care, durable medical equipment for use at home like wheelchairs and walkers, ambulatory surgery center services, and ambulance and emergency room services. Part B has a monthly premium adjusted for income, cannot be denied. Coverage is nationwide, including any provider who accepts Medicare, and there is a premium penalty for late enrollment. Original Medicare is Parts A and B, and they do not cover all the costs of your care. You have out-of-pocket costs with no limit. Prescription drugs are not covered. Routine dental, vision, and hearing care is not covered. Eyeglasses, contacts, or hearing aids are not covered. Long-term or custodial care, help bathing and eating and dressing is not covered. Excess charges for services by doctors who don't accept medical assignment is not covered. And care received outside the U.S., except for certain circumstances, is not covered. How much does Medicare cost? What is a premium? A premium is a fixed amount that you pay for coverage, usually monthly. A deductible is a set amount that you pay for covered services before the plan begins to pay. A copay is a fixed amount you pay at the time you receive a covered service. And coinsurance. Coinsurance is the amount you pay when the cost of a covered service is split with you by percentage, such as 80-20. 2020 Medicare Part A costs, and this is your hospitalization. There's no premium for most people. There is a deductible for each time you're admitted to the hospital, which is called a benefit period. This deductible is for 60 full days. In other words, you are admitted to the hospital, you pay $1,408. Also, be aware that there is no out-of-pocket limit. Here is a diagram. For example, Matthew is admitted to the hospital in January and stays for 5 days. He is readmitted in April and stays for 65 days, more than the 60 days passed between Matthew being released and readmitted. So, for example, as you see, the first day, Medicare Part A has a deductible of $1,408. So Matthew pays that $1,408, but he's only there for 5 days, so he doesn't have to pay anything else. He is then readmitted later that year, and now he has another $1,408 that he has to pay as a deductible, and that gives him through day 60. So he has 60 full days that he doesn't have to pay anymore, but on day 61 through 65, he pays $352 per day, which totals $1,760. So for that year, he has paid $4,576. Part B. This is your medical costs. There is a premium of $144.60 per month. Now, this premium is adjusted every year. Every year, the premium can go up or can go down. Also, there's a deductible of $198 per year, and that can change from year to year. In addition to that, you have a 20% coinsurance. So in other words, you pay 20% of the approved amount for most covered services and any excess charges that may occur. There is no maximum out of pocket. And here is an example of how that works. Ellen goes to a doc that accepts assignment. If you look at the list here, she only pays $44 out of pocket. If she goes to a doc that does not accept assignment, that means that she's going to pay more because she has to pay the excess charges. So you can see if she goes to a doc that accepts assignment, she only pays, in this case, she only pays $44. And if she goes to a doc that refuses assignment, she would be paying $73. Now you ask, where can I get more coverage? Well, we've got options. Option one is getting a Medicare supplement insurance plan, and this is offered by private insurance companies. It helps pay some of the out-of-pocket costs that come with original Medicare. And you can also get a Medicare Part D plan, which is also offered by private insurance companies, and that is your prescription drug plan. It helps pay for prescription drugs. Or you can go to option 2 and get a Medicare Advantage plan. This is also known as Part C of Medicare. Combines Part A, hospital insurance, and Part B, medical insurance into one plan. It also usually includes prescription drug coverage, and it may offer additional benefits not provided by original Medicare. Let's talk about Medicare Advantage, Part C of Medicare. Another way to get your Medicare benefits, an alternative to original Medicare Part A and B. Plan members are still in the Medicare program. Benefits are administered by the plan and plans offered by private insurance companies. All Medicare Advantage plans cover all the benefits of Part A except hospice care, which is still covered by Part A, and all the benefits of Part B. Most Medicare Advantage plans cover prescription drugs. Medicare Advantage plans may offer additional benefits and features such as dental exams, cleanings, and x-rays, eye exams, eyeglasses and corrective lenses, hearing tests and hearing aids, wellness programs, and fitness memberships. Medicare Advantage plans have an annual out-of-pocket maximum to help protect against high costs. Medicare Advantage plan types: coordinated care plans, health maintenance organizations, these are called HMOs, preferred provider organizations, those are PPOs, point of service plans, POS, special needs plans, SNPs. Other plan types are private fee-for-service plans, those are PFFS plans, and medical savings account plans, MSA plans. Medicare Advantage, fast facts. Must be enrolled in both Medicare Part A and Part B and live in the planned service area. Can't be denied coverage based on current financial or health status, including pre-existing conditions. May be required to use provider and pharmacy networks. Coverage and costs vary by plan and may change each year. Additional limit on out-of-pocket costs for covered services, may charge a monthly plan premium, and must continue Part B premium to Medicare. Medicare prescription drug coverage helps with the cost of prescription drugs. 2 ways to get the coverage. You can add it as a standalone Part D plan to original Medicare, or you can choose a Medicare Advantage plan that includes prescription drug coverage. Plans offered by private insurance companies. Prescription drug coverage plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included in the drug list, which is also called the formulary, and commercially available vaccines not covered by Part B. The formulary is a list of covered drugs. Tiered formulary. Drugs are grouped in tiers based on cost. In general, the lower the tier, the lower the cost. Deductibles may be charged by tier. What is the donut hole? There are different coverage stages for prescription drug plan Part D. You have your annual deductible, you have your initial coverage, then you have the coverage gap, which is also called the donut hole, and then you have catastrophic coverage. Medical prescription drug coverage, fast facts. You must be enrolled in Part A and Part B or both. You may be required to use a pharmacy network. Coverage and costs vary by plan and may change each year. And Part D premium penalty for late enrollment if you don't start your Part D when you're first eligible for it. Medicare Supplement Insurance. It's also called Medigap. It helps pay for some of the costs not paid by Medicare. It supplements original Medicare, Part A and Part B. It cannot be used with Medicare Advantage. Medicare Advantage and Medicare supplements do not work together. There are 8 plans with benefits standardized by the federal government. There are 3 states where the plans are different from the standardized plans: Massachusetts, Minnesota, and Wisconsin. Plans offered by private insurance companies in your state. Plans may help pay for Part A and Part B deductibles, co-pays, co-insurance, and provider excess charges, costs for extra 365 days of hospital care after the lifetime reserve days have been used up, costs of blood transfusions for the first 3 pints, costs of foreign travel emergency up to the plan's limit. The plans do not help with prescription drugs, nor do they help with routine dental, vision, or hearing care. They don't help with eyeglasses, contacts, or hearing aids. They don't help with extra days in a skilled nursing facility after Part A benefit is used. Custodial care, help bathing and eating and dressing. That does not work with Medicare supplements, and Medicare supplements does not work with long-term care. Here is a chart that shows you the standardized Medicare supplement plan. Here are some fast facts of Medicare supplement insurance. You must be enrolled in both Medicare Part A and Part B and live in the state where the plan is offered. There is no medical underwriting up to 6 months after enrolling in Part B at age 65 or older. There is nationwide coverage and no provider network. It is guaranteed renewable. Plan premiums may vary even for same coverage. Plans with more coverage generally have higher premiums, and you must continue to pay for Part B premium to Medicare. How do I choose? Here's some Medicare combination. With original Medicare, you can get number 1, Part A and Part B. Number 2, you can get Part A, Part B, and D. Number 3, you can go with Part A, Part B, and a Medicare supplement. Number 4, you can get Part A, Part B, Part D, and a Medicare supplement. With a Medicare Advantage, you can get Part C by itself. You can get Part C and Part D separately, or you can get Part C and Part D as a combo. With Medicare coverage choices, step 1 is to enroll in original Medicare, and step 2 is decide if you need additional coverage. There are 2 ways to get it: Medicare Supplement or Medicare Advantage. That's very confusing. A lot of people don't know which one is best for them. These are the things to consider. Coverage. Medicare Supplement pays some costs not paid by original Medicare. Medicare Supplements does not help with drug costs, and they do have nationwide coverage. Medicare Advantage provides benefits of original Medicare and beyond, and often includes drug coverage and may have a provider network. Let's compare costs. Medicare Supplement has a monthly plan premium, generally a fairly substantial premium. Drug plan premium and other costs if coverage is added, and out-of-pocket costs depending on the plan chosen. Medicare Advantage may charge for a plan premium, often no additional premium for drug coverage, copays or coinsurance for most covered services, and it has an annual out-of-pocket maximum. Here are the conveniences of each type of plan. A Medicare Supplement has multiple plans when added to original Medicare along with Plan D, and a Medicare Advantage is an all-in-one plan. When can I enroll? Enrolled in Part A and Part B automatically if receiving Social Security or Railroad Retirement benefits at age 65, or after receiving Social Security disability benefits for 24 months. Enroll yourself if not receiving benefits. Go to the ssa.gov website or the local office. Enroll early to avoid gaps in coverage and late enrollment penalties. May refuse or delay enrollment in Part B, and you may enroll in a Medicare Advantage or a prescription drug plan. General enrollment period every year. For those who miss their initial enrollment period, may enroll in Part A, Part B, or both. May choose to enroll in a Medicare Advantage plan Part C or a prescription drug plan Part D. Late enrollment premium penalties may apply. Medicare Supplement open enrollment. No medical underwriting if you enroll during this time. May enroll in a plan later but could be denied or charged more based on health history. Special enrollment period working past 65. For those who delayed enrollment, may enroll Part A, Part B, or both. Part B enrollment triggers Medicare Supplement open enrollment. May choose Part C or Part D plan and enroll in Part D early to avoid penalty. Late enrollment penalties. Medicare Part A. None if qualified for premium free, otherwise 10%. Part B. None if qualified for SEP, otherwise 10% for each full 12-month period. Part D. None if less than 63 days without creditable coverage, otherwise 1% of the current average premium for each month. When can I change my coverage? Medicare annual enrollment. You can switch from original Medicare Parts A and B to a Medicare Advantage plan Part C or vice versa. You can switch from one Medicare Advantage plan to another, and you can join, switch, or drop Medicare prescription drug plan. Medicare Advantage open enrollment. It's available to Medicare Advantage plan members only. You can switch to a different Medicare Advantage plan or return to original Medicare. You can enroll in Part D plan if returning to original Medicare. And you just have one coverage change allowed. Special enrollment period for qualifying events. And these are the qualifying events. If you move out of the plan service area, if you move within the plan service area and have new plan options, if you leave or lose other health care coverage, if you qualify for special needs plan, or if you move into or out of an institution such as a nursing, or if you get or lose financial help with Medicare, or if you move back to the U.S. after living outside the country. How can I save money? Use plans wisely. Use preventative services. Stay in the plan provider network. Ask about generic or low-tier drugs. Use plans preferred or mail order pharmacy, and understand your status in the hospital. Financial assistance plans. You can call your state SHIP office, SHIP, and you can get extra help with drug costs. Medicaid provides health care coverage for both people and families with limited income. Medicare savings plans help pay for Part A and Part B costs. Programs for all-inclusive care for the elderly provides care services for frail elderly living in the community. Where can I go for help? MedicareMadeClear.com for more information, as well as videos, quizzes, downloadable guides, and online tools and more. Sign up for our newsletter and get practical, up-to-date articles delivered right to your inbox. Follow us on Facebook to stay current with Medicare news. Visit our YouTube page to watch videos on Medicare and health and wellness topics, and view MedicareMadeClear.com in English, Spanish, Vietnamese, and Chinese. There is a National Medicare Education Week, September 15th through the 21st, devoted to helping people learn about Medicare, get answers to questions, feel confident making Medicare decisions, and participate through local educational events and online activities. More resources, you can visit Medicare.gov. Call the 1-800-MEDICARE telephone line 24 hours a day, 7 days a week. Call your state health insurance assistance program. That's SHIP. Get the number at shiptocenter.org, SHIPTACENTER.org, or contact your local Social Security state Medicaid office.